the worst behaviors you accept as a practice owner and leader is going to set the bar for how your culture is. And if you allow someone to get away with toxic behaviors because they're a rock star, best assistant ever, she's got 17 arms, right? She can, it doesn't matter because your patient isn't going to be getting the best result because your team culture is going to be hampered because you're allowing bad behavior.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a dated dental nerd and your host.
Welcome everyone to another episode of the Growth in Dentistry podcast. My name's Steve Jensen and your host, and I am so excited for today. Before we jump in, I just want to remind everyone, if you haven't checked out Dental Intelligence for a little while, I want to give a huge shout out to their marketing team for sponsoring this podcast week after week after week. And as part of their sponsorship, as always, they have cool offers for you. So if you'll come and check out a demo of the software, they will give you a $50 gift certificate just for taking a look. And if you haven't looked at Dental Intelligence in a long time, they're constantly releasing new features, new things. Like just recently, they just released a new scorecard type. So you can start analyzing some of your insurance relationships. And I hear it's only going to get cooler. So if it's been a while since you've checked it out, definitely come and give it another look. Worth your time for sure. Now, I think that's the only thing I have on my docket before I jump in for today. So this episode is part of the series that we call the Practice Deep Dive episodes. And just as a reminder, if you've not been to listen to one of these before, what I do is I go look at all of Dental Intelligence customers. There's just over 10,000, and I try to find practices who are in the top 10% of not just like one metric, but they're consistently high performers in a number of metrics. And today, I'm going to bring on with me Dr. Ben Friberg. And I actually had him on a couple years ago, and the practice was high performing back then, and it is even more high performing now. And so I'm interested to hear from him, like what refinements he's made and maybe some of his perspective changes that he's had since the last episode. And before Dr. Friberg, I bring you on to like officially introduce you, I want the listeners to hear a little bit about your practice. So I'm going to say it through the eyes of DI with some numbers. So last year, this is, mind you, with one doctor, 6 total team members, 2 admins, 2 assistants, 2 hygienists. They did just about 1.7 million in collections. So like monster practice for their size. That's all while taking 7 weeks off for vacation. Okay, so for those of you that are like, man, I wish that my dental practice didn't own my soul all day, every day. This is definitely an episode where you're going to want to like let your ears perk up and listen. He works 3 7-hour days, 1 6-hour day as a doctor clinician. And a couple other things about the practice. Why did I bring him on? Their patient retention is really high. It's one of the things that grabbed me the last time. Hygiene reappointment is consistently over 90%. In fact, it's typically like 93, 94, 95%, which tells me that their patients enjoy coming in and they're looking forward to coming to the next visit. So there's something about the culture of his business that I think is probably really fascinating. The second thing that caught my eye was their annual patient value. The average annual patient value in the dental practice is typically around $660 something. And in Dr. Friberg's practice, it is right around $1,100 annual patient value, which is just our total collections divided by total active patients in the practice. So that's also really exceptional. It tells me that patients are saying yes to treatment, that he's presenting more than just the average drill and fill stuff, and that patients are compliant. They're interested in continuing to do work with Dr. Friberg and the team. Now, I could go on and on. There's other things too, like new patient retention. Their collections process is actually really good as well. Like they collect 100% of what they plan to collect. So their average accounts receivable days is only 19 when the industry average has ballooned up to over 40. So like they're like half. So they're collecting really well from insurance and from patients. So anyway, there's so many things we could like dive into with you, Dr. Friberg, but I'm going to stop there and I'm going to introduce you and let you start being the talking head now. So welcome to the podcast. How are you doing, man?
I'm great. Thank you for having me. And to go back to what you started with at the very beginning, if you're not using Dental Intel, you're probably missing out on a lot in your practice. One of the reasons why we're able to perform at the level we perform
Mhm.
is that we have dental intel's data. You didn't ask me to give a spiel, but
Yeah.
with everything you just talked about, one of the what gets measured
Uh-huh.
gets gets managed,
Yeah.
right? And so if you don't know the numbers, you don't know what you're missing. You don't know that your team might be, completely forgetting to reappoint people. And there's a lot of ways to mismanage a practice. And dental intel helps us keep focused on all of the data so that we know what we're doing.
Yeah, I didn't ask you to give a pitch, but thank you. I agree with
Yeah.
that. I've had
Yeah.
several practices come to me kind of on the side. They hear me on the podcast and I, speak a little bit in the industry and they'll come and say, "Hey, like, could you like help coach me and my team a little bit?" And that's always one of my things is like, look, like I don't know how to look at a dental practice and like give you actual
Hmm.
good suggestions for your business unless I get to go look under the hood with dental intelligence. So I'm
Yeah.
a big believer in that. Now, you've had some shifts in life. Give us some updates. You've written a book
Yeah.
called The Seven
Yeah.
Figure Practice Blueprint for Dentists. I think you're doing
Yeah.
some coaching now, trying to spread some of the knowledge that you've gained. Tell me
Yeah.
a little bit about that.
What's interesting is, when we met last, that was about a little over 2 years ago.
Mhm.
I was in the process at that point of kind of rebuilding my practice into the image that I had originally intended. I started my startup in 2019,
Okay.
and we had rapid growth, and we did over 1 million in production in our first year. By the end of year 3, we had over $2 million in production, and we were working really, really hard. We had a 12-hour shift, Monday through Friday, just that startup grind. And I realized at that point that the practice had taken ownership of my life.
Mhm.
Um, and that the practice wasn't doing what I thought a dental practice would do for me when I decided to be a dentist, you know, 15, 16 years ago. So I was in the process of kind of recreating the practice, and we changed our schedule, we changed our relationship with insurances, and we went through a lot of intentional changes to make the practice what it is today so that we can take 7 weeks off. My team gets 6 weeks paid vacation every year so that I can work 27 hours a week, uh, so that I have time to write a book and start a consulting company and share kind of the passion that I have and the systems that I've created within my practice and now other practices so that we can have practices that support the life that we want, right? I talk to my clients is the one thing that a dental practice should always do is create a fulfilling life for the dentist.
Hmm.
Because if it's not doing that, what's the point?
Yeah.
Right? Like I can do exceptional patient care and I can love people and as an associate. I don't need all the stress and the pain and the frustrations that come with running and owning the practice and the risk, right? So if it's
Mhm.
not adding to the fulfillment of my life, my practice has been organized poorly.
I want to like press on that because I think this is a very common thing. I'm in dental Facebook groups and conferences, and I hear the way
Mhm.
dentists talk, like, and I think it's a very common feeling for dentists to feel like, well, like I'm the chef and the restaurant owner. Like I have to make the food. That's why people come. So with dentistry, that
Yeah.
can feel, I think, sometimes like a little bit of a trap or a hamster wheel. Um, what are
It's an
some
interesting
early
point that
warning signs? Yeah, what are some of the early warning signs? It's like, hey, my practice
yeah.
might be running me instead of, me proactively running my practice.
Yeah, it's an interesting point you make where you talk about the chef and the restaurant owner, right?
Hmm.
Um, Being a clinical dentist, the skills that we had to learn took the majority of our adolescence and our youth. And, we don't really get to practice ownership till late 20s, early 30s at the earliest for
Yeah.
most people. So um, it's no wonder that dental practices are hard to run because we were never trained to run them, right? The skill set that comes with becoming a dentist has nothing to do with the skill set of being a healthcare entrepreneur.
Yeah.
And so it makes sense that people get burnt out because they think that they should be able to do it all themselves because they're solely responsible in the clinical sense for the outcomes, the diagnosis, the treatment plan. But in the practice, that skill set is a huge detriment. That mindset is a huge detriment of I have to do everything. It all relies on me. I'm the centerpiece here. And that's where having a great team around you and having great leadership skills allows people to be the best at their individual tasks through your practice, where you're able to delegate tasks, get out of their way, and let the practice grow in such a way that allows you to have the lifestyle that you want. But some of the red flags that you had mentioned, I would say, is staying late or having to go in early routinely, feeling like you're never caught up and there's always more to do, feeling like your team doesn't care or they're not engaged. Those are all signs that there's something going on that could be improved in the practice, to give you that freedom that you want to live a life that dentistry can provide, that a lot of us pursued dentistry in the first place.
Now I want to ask another question, because I think as people listen, one of the things I was kind of flipping through your book. Okay, so pretty common to see conversation around making sure we have a clear. So maybe I'm in that situation where it's like I feel like my practice is running me, and to get out of that, I need to have a clear vision, mission, and some core values. Like, what do I want my practice to look like? I want to be fulfilling. I want to enjoy work more. Could you maybe give some examples? I think sometimes that can feel very like nebulous for a dentist. Like, I think they're very scientific. So to have them say, hey, like, you need a mission, vision, and core values, they're like, okay, like that sounds fluffy. Can you give me some examples of like what are maybe some good, some mission, vision, value things that you've liked personally? And then maybe to connect the dots for listeners, like how do those end up, or how can those even influence like day-to-day decision making? Can you use those in a more productive way that's like, hey, it's actually applicable, as opposed to just something that lives, on a piece of paper on the wall or in a break room?
That's a great question. So with my clients, the number one thing that we do when we get started is actually creating a personal vision for your personal life.
Yeah, cool.
That's paramount. Like that's everything when we talk about how do we create a practice that's fulfilling, because we need to understand what it is that fulfills us in the first place in our personal lives. And then we can start making decisions in the practice and design a practice vision and practice mission, and core values that then reflect what the doctor's personal vision, mission, and core values are. So I talk about one of my core values is that I want to be present for my children when they're growing up. And it was my son's 5th grade graduation a couple of years ago. And I had messed up the schedule. I said, I need this day off. My office manager scheduled the day off, and it was the completely wrong day, like by weeks.
Oh, no.
And so I kind of got lost in the shuffle, and it was Monday, and the graduation was Tuesday morning. And I tell my family, I'm like, I've got patients all day tomorrow. I can't be at the graduation. They understood. They were disappointed. And I remember driving to work the next day and driving past my son's school. And I knew that I had to cancel my patients that day, right? My practice was violating one of my personal core values, right? And so I called my office manager. I said, hey, cancel my morning. I'm gonna go to my son's graduation. And they knew that was my core value. They knew that their job is to help me have a fulfilling life, just like it is mine to them. And so they all jumped on the phones. They got the morning off, coffee and donuts. I got to see my son at his graduation. And that's the thing that we want to create for all of our doctors, is a clear decision making. We make algorithms in our treatment plans. We want to have the same thing in our personal and professional lives, that we have an algorithm, a hierarchy of decisions that we make to make sure that our life stays aligned to our personal vision, not to our practice vision. In the practice, a practice vision becomes the overarching decision-making tool and mechanism when we have options of two, or we have choices between two good options, right? That's when it really comes into play. Because do I overcharge a patient, or do I have integrity and I charge them the right amount? It's like, that's a no-brainer. You don't need your practice vision. You just need to have a good conscience, right? But it might be, how do I pay my staff when they're out sick for a little bit longer than their PTO covers, right? Well, my practice vision is that everyone who interacts with Thrive Family Dental is treated with love, dignity, and respect. Well, give them a little bit of extra PTO as they're recovering from maybe a procedure or something. That's something that gets filtered through my vision. right? Same with my patients. If there's a way that we need to deal with something that's in the gray area of some of our financial policies or treatment policies, how are they treated with love, dignity, and respect? And then the same for my mission and core values. So, our core values are the tenets that our team believes as the foundation for the culture that we live out every day in our practice. So if everyone is working and acting within our core values, our company culture is really, really positive. But when we have people coming in who aren't aligned with our core value, or they're not focused on it, and they're violating our core values, it creates tension, it creates friction. They're not acting in a way that is in line with who we are, and our culture suffers. And so that's where core values come into place. And it's how I correct my team as well, right? If there's actions or behaviors or attitudes that are not in line with our culture, I can grab them and say, hey, this is what I've noticed. I really enjoy you being here. I'm glad that you're part of this team. But right now, this is what we need you to do, because one of our core values is all hands on deck, right? And I've noticed that at times when everybody's cleaning up at the office in the day, we tend to find you more in an operatory just working on your notes by yourself. So as our core value of all hands on deck, during that time, I want you to be conscious of that, come out, work with everybody, make sure that everybody is working together for those tasks, and then you can finish up the personal stuff. Right, so that's how core values directly interact with my team and culture.
Yeah, that's great. I'll say this too, that like two things. One, as you were talking about that moment when you decided I'm going to cancel my morning, I'm going to my kid's graduation, when your life decisions line up like that and you feel this like sense of commitment to I'm going to live the way that I committed to living, there's a great sense of exhilaration that comes from doing that. There's also a great sense of like this just centered feeling that comes as you can like really connect your vision for life, like just lessening the gap between like who you are and who you want to be, right? And the
Yeah.
smaller the gap we can create there of who we want to be and where we are, the more aligned you're going to feel with the movement in your life. So I'm a huge fan of that. The second thing is that I agree with you. Culture is everything in a business, both a really small business as well as a really big business. And one thing I will say that I think is a common problem I see in leadership is a lot of times we might have a skilled team member and might let them get away with bad culture things because we're worried about losing their skill set. Do you have any feedback you'd give to someone where they're in that pickle where it's like, yeah, but this person's like so good, but at the job to be
Yeah.
done, but culturally, man, they're kind of tough.
Yeah, that is, I mean, I would say that's one of the biggest challenges in determining how to manage and lead your team,
Mhm.
right? If you've given this person enough opportunities and corrections to kind of get on board with the team culture, but they're still acting in a toxic way that's negatively impacting your company's morale and your team culture, then they have to be let go regardless of their skill set. And the reason why is that it is unfair for everyone else who is upholding the core values, the mission, the vision. It's unfair to them to be in a work environment where that is not being recognized completely. It takes the whole team to create a great culture, and it takes one person to destroy it.
Yeah.
And it's your job as the owner, as the one who makes the decisions of who is and who isn't in your team. It's your job to protect the rest of your team from toxic individuals and protect your patients, because the experience that your team gives your patients is a reflection of your culture, which is a reflection of the least, um, it's a reflection of the worst behaviors that you accept.
Mhm.
Right. So the lowest level of behavior, the worst behaviors that you accept as a practice owner and leader, is going to set the bar for how your culture is. And if you allow someone to get away with toxic behaviors because they're a rock star, best assistant ever, she's got 17 arms, right? She can, it doesn't matter, because your patient isn't going to be getting the best result, because your team culture is going to be hampered because you're allowing bad behavior.
Yeah, and I'll share this too. I think I agree with that. I'll share with folks on the other side of those hard decisions, it's never as scary as you think it is. That's one lesson I've learned through scaling dental intelligence and just work life. I'm not super old, but in my, late 30s, so I've seen a few things at least at this point. And on the other side of graduating from a team member or making a difficult decision, what's on the other side of those new things for you is not that scary. Stuff that
Yeah.
we can get through, and a lot of times it's actually more exciting once you get some time and space from the move. So.
And the other thing that people need to realize that dentists that I work with a lot, one of their biggest things is afraid to hold people accountable
Mm-hmm.
because they're afraid they're going to come off as a jerk or that the person's going to be upset and leave, right? So there's this hesitancy to actually correct and hold people accountable to behaviors. And what I'll say to that is that it's actually the exact opposite. Your company morale and their enjoyment at work will increase if they are held accountable to things in the practice. If there's boundaries in place and there's feedback on their performance and attitude, their work performance will increase, their attitude will improve, and they'll enjoy their job more, or they will self-select out of your practice because they realize that they don't belong there.
Mm.
So it will either have a net positive effect of improving your team's culture and performance, or it'll have a positive effect that they will self-select out and you'll not have to worry about it ever again.
Yeah.
So the action of not doing anything as the leader in your practice is a net negative. You won't get the increased performance and you won't get rid of somebody who doesn't belong. So the only thing to do is to hold people accountable, set expectations and standards so that your team is always moving in a positive direction.
Now I'm gonna keep drilling into this accountability piece because I think it's one of the elements that make you and your practice particularly successful. Is I think when people operate in good systems of accountability, it just creates really good, predictable results. So
Yep.
we've been hitting, I think, on one element of accountability, and that's more of the core values side, which I think is, like you mentioned, more like attitudes and has a little more subjectivity to it to some degree. Um,
Mhm.
I'd love to hear maybe some of the other side of things. So how you hold the team accountable from more of like a measurement standpoint. I know in your book, one of the things that I mentioned that I really liked was this model you have, the define, refine, and implement model.
Yeah.
And, I don't know if that plays perfectly well into the conversation around like each team member accountability, but I'd love to hear your thoughts on that.
Yeah, so that framework of approaching challenges in your practice of define, refine, and implement works really, really well for accountability. I believe that every employee wants to do the best that they can. I think everybody wants to be a great employee. That's a foundational belief that I have in the way that I approach my team. And that optimism allows me to approach individual members with accountability in a positive way, right? I am working alongside of you to achieve a common goal together. I'm not standing above you telling you what you've done is wrong and you need to do better. So instead of coming at them from authority, I'm trying to come beside them and lead. And so if we have a problem in the practice, let's say that we're running out of materials. My lead assistant didn't have 3 things this week that were supposed to be ordered and we ran it. I would go to her and say, hey, this is the problem that I've noticed. We've run out of several items this week that are normally always in inventory. Help me understand what's going on, right? Tell me what the process is that you're going through to order. What's the system that we currently have? Good feedback, good conversation. And then I would ask the question, hey, what do we need to do to our system here for ordering inventory to make sure this doesn't happen again? Because it really is negatively affecting patient care. It's making you feel more stressed when things don't show up. It's making me feel more stressed when I can't do a procedure. So how do we correct the system? Great. That's a great idea. Okay, so every Monday morning from 10 to 10:30, you're going to go through the inventory checklist to make sure we have everything. Awesome. Let's make sure we do that. Let's visit in 2 weeks from now, see how that's going, so that we can create a system that's robust and that we don't miss stuff.
Mhm.
All right, so we defined the problem. The employee and I refined it together. We implement it, and then we have a follow-up system. And that's how we go through everything in our practice. That framework, always alongside, never above, to make sure that we're growing in the right direction.
Yeah, and then I think I like that too because then, in that define and refine and implement, like you just have clarity through the whole way, as a team member and as a leader of what's expected of everyone in the process. So I like that a lot. Now, let's see, what are I'm looking at my questions here to remind myself what I've hit so far and what I haven't. So let's see. Oh, this one, the book. This is like a little bit of a switch up, but in your book, you talk about the importance of internal and external marketing for dental practices.
Yeah.
Do you want to hit some I don't know if it's common mistakes that you see people make or advice you have for creating
Yeah.
marketing strategy and making sure, I think one of the things that I liked was that you talk about how like you want to align that with your practice, right? So that it feels like authentic and just make it more effective. So talk us through, or maybe talk us through what you've done and advice you might have.
Mm. So I think one of the chapters I have in the book is called "You're the CMO," right? You're the chief marketing officer for your practice. You don't need to know every tactic that's being implemented in your advertising, right? That's too deep. That's too drilled down.
Yeah.
That's not a good use of your time because that's not your core competency, right? That's your marketing company who you've outsourced to. But
Yeah.
what you do need to do is have a broader marketing strategy, right, of who you are as a practice, what you represent, who you want to draw in, right? So my clients, we always do what's called an avatar exercise, is defining as granular as possible who your ideal patient is, and then creating an advert or a marketing plan and then an advertising plan to reach that person. And the reason why is that when you know exactly who you want to target, your messaging will be effective.
Mhm.
Instead of being broad based and like everybody come to the dentist because you've got teeth and I've got a drill, right? That's not going to attract anybody,
Uh,
right? So differentiation, being unique, drilling down to reaching that one patient
yeah.
allows your marketing to be a lot more effective, right? And we could have different campaigns with different avatars, so that's fine.
Yeah.
But one practice that I work with is really, really high end. Like she hires a masseuse to come in and give foot massages while her patients are getting their teeth cleaned.
See,
Like,
that's sweet. I need her to come to
that's
my shop.
spa level, right?
Yeah.
Well, what you're not going to do is you're not going to have advertising that says buy one get one fillings and 100, and
No.
30% off of your Invisalign, right? You don't want to use tactics that do not reflect your brand and the person that you want to come in. People who go get their teeth cleaned and get their feet massaged and are willing to pay for it are not a price conscious patient. So don't use pricing as an advertising tactic, right? So making sure that you're aligning your avatar all the way through your marketing, through your advertising. And that's a big mistake that I would see.
Yeah, and I agree. I think even another example I've heard used before where sometimes there might be gaps in what we think. I think some dentists won't connect the dots all the way. They'll think, okay, I'm going to invest a lot of dollars in getting good at implants, for example. And then they'll think, if you ask them, hey, what's your ideal patient profile? They're like, oh, country club, high.
Yeah,
Yeah. And then all of a sudden you're like, okay, well, there's this gap between your clinical skill that you're hoping to advertise and the patient profile, right? Like, how often do you go to the country club and see folks missing teeth? Like,
right.
those are the situations when you need implants done, right? So, um, making sure that you have this strategy where maybe if you want to do high-end cosmetic work, that might be the case. That might be your,
Precisely. Yeah.
yeah,
The other
make,
thing I think that a lot of doctors do, it's oftentimes the way they treat their teams as well, is to set it and forget it. Right. It's like I hired the advertising company, they made my website, I tell them to bring me new patients, and I'm just getting nothing but garbage.
yes,
I'll say, well, when was the last time you had a strategy session with your project manager, your marketing team? Oh, I don't know. It was months ago. Okay, well, they don't know then that what you're getting isn't what you want. So you
yeah,
need to have a constant accountability relationship with all of your providers, with your CPA, with your financial advisor, with your marketing company, right? All of these people you need to have regular communication with so they can help you better. But unless you're willing to engage in those conversations, then you're not going to have good feedback. You're not going to have great results.
mhm.
You can't kind of divorce running your practice, being the entrepreneur. Um, you can't be divorced from that and expect to have great results.
Now we're coming up fast on time, faster than I realized. So before I jump in to like my last question, is there
Sure.
anything else that you're like, hey, this is something I've had on my mind that I wanted to make sure I shared while I was on the podcast before I jump into my last question?
All of these skills that we're talking about today, leadership, both from personal leadership to team leadership to management of your practice through, understanding your key performance indicators through dental intel, uh,
Nice.
and through marketing, right? All of these things are learnable skills that you have to exercise intentionally to get there, right? I was lucky that I have a business degree and I started in business at the age of 19 in the construction industry. Um, Owned multiple construction companies. I've done thousands of interviews and had companies of over 100 employees. And I've learned a lot of this through that time, right? And then I became a dentist. So I was entrepreneur first, and then I learned how to become a dentist. My peers primarily learned how to be a dentist and now can learn how to be an entrepreneur, right? And that's my favorite thing to do, right? Is to take a dentist who goes, I need to learn how to run this business, right? And we go from being somebody who owns a practice and turn them into a healthcare entrepreneur. And it's really fun.
Well, I should have just asked my last question because my guess is that your answer is going to be really similar. Because my last question, I ask everyone, the podcast is called the Growth in Dentistry podcast. And so I
Yeah.
ask every guest the question, what does growth in dentistry mean to you? I ask that as the last question. So, you can swap up your answers or give us a similar spin.
Yeah.
But Dr. Ben, what does growth in dentistry mean to you?
Personally, growth in dentistry means to me is always being pushing right to the next level, whatever that is. And that does not mean collections, right? It does not mean profit. More isn't always better. Sometimes more is just more. But growth could be personal growth, either mental health, um, physical health, financial health, spiritual health, right? That's growth. Pushing into those areas of your life and growing there will positively impact your practice. I will guarantee it. And if it doesn't, call me, right? Like it will make a huge difference, right? So that's a form of growth. Or if it's leadership, hey, I want to be better at managing my team to get the best out of them, right? That's growth. And I think trying to do it all on your own isn't effective, right? Because there's so many blind spots, and trying to figure this out by yourself, it's really, really hard. And dentistry is really, really hard. And owning a practice is really, really hard. And doing it alone um, is not a recipe for success. So surrounding yourself with peers, making sure you've got good relationships, and looking at coaching in some form or another that you really resonate with, I think is important. To have mentorship, to have coaching, and hiring consultants to come in as well to deal with specific problems that you're having to grow your practice. So that's what it means to me, and that's why I've engaged coaches and consultants for my entire from when I was in the construction industry through now. I've always had coaches or consultants working with me.
Yeah, I'm a huge believer in that. I don't know that I would have maybe said that even just like 3, 4 years ago, but for listeners just to like hear, it goes beyond even just like business, life too. Like I decided to get into running like 4 years ago and was making some progress, but not like a ton. And then this last year, so a year ago, I was like, you know what? I watched a bunch of YouTube videos, like learned a lot of good things, but then I was like, I'm just gonna hire a coach to help me with running.
Yeah.
And went from a 4 hour marathon to this last September, a 2 hour and 59 minute marathon. And then I'm doing one here in a couple of weeks. And I'm on target to run around hopefully a 2:49. Hopefully I go sub 2:50, but have made like a ton of progress in a relatively short amount of time when you just have someone that knows what they're talking about. The second thing I'll say too is beyond a coach, having like a community. So one of the things I've learned in running that I thought translates well into business because I've seen this in my business career as well. And that's that when I go and I was trying to just run by myself for a lot of years. And as soon as I started running with other people who were interested in running, curious about running, wanted to be better runners, I just, I put myself in a position where I could just learn from them and just kind of organically cool lessons would pop up where I'm like, I see what they did just barely, and I'm gonna adopt that in my training. or you just learn stuff when you put yourself next to other people
Mhm.
who are trying to do cool things as well in the same field as you. So I would also anyway, I totally agree, Dr. Friedberg,
Yeah.
for what you're saying. Now, you how can folks get a hold of you? I think you've got a website, right?
Yep.
drfreeberg.com.
Yeah. So it's drbenfreeberg.com. And then to sign up for the book to get information about when the book releases on May 20th, it's drbenfreeberg.com/book.
Ah, okay.
And then, yeah. And so the thing with the book is not just me talking at you, right? There are specific worksheets, there's questionnaires, there's things that are going to move you and your practice forward. And then through the book, there's also resources of how of worksheets and things like that. They're going to help you identify what your personal vision and mission and core values are, what your practices are, how to run meetings, right? What are good agendas to have effective meetings that everybody doesn't just roll their eyes the whole time, right?
Mhm.
So that's all going to be accessed through the book.
And then do you do I probably should have asked this before, but do you do any speaking? I know lots of listeners, probably attend like a local study group or, are a part of some local association that has people speak. Do you do speaking if people are like, hey, I think it'd be
Yeah,
cool, Dr. Freeberg,
yeah, absolutely. So I do speaking for organizations and mastermind groups,
Cool.
and also I do workshops. I really enjoy doing workshops, right? Because I can talk, as you everybody listening now knows, but I think that shared learning experiences are more powerful, more impactful, better ideas come out, and it's more empowering when you actually get to work the material. So we do workshops where we introduce a topic, we introduce a group work exercise, and then we get together as exceptional, intelligent doctors and create the best um, opportunity for learning together.
Perfect. Well,
Yeah.
guys, if you're interested in getting connected with Dr. Freeberg, I would definitely suggest like jumping on that website. We'll throw that in the show notes. Dr. benfreeberg.com. We'll throw that in there as well as the slash book as well. Thank you for joining us again, Dr. Freeberg. It's been an
Thank
absolute
you.
and thank you to all the listeners for joining us for another week. Once again, this has been another awesome episode of the Growth in Dentistry podcast. My name's Steve Jensen, your host and fellow dental nerd. Keep growing, and we'll talk soon.